Hello and welcome. It's a real pleasure to start this webinar. My name is Tim Chico. I'm Director of the South Yorkshire Digital Health Hub. We're showing the agenda. I'll give a brief summary of what we're trying to achieve, and then I'll pass to my colleagues. As a bit of housekeeping, please put any questions in the Q&A, which you can see the box down at the bottom of the screen, and then after we've spoken, we'll try and address all those questions. The webinar will be recorded, and if you have questions that occur to you straight afterwards or at any time, don't hesitate to email us and we will address those. So if you haven't used Zoom before, the Q&A box is down at the panel there. So why are we here? We were funded by the Engineering and Physical Sciences Research Council and UKRI to do two things. The first was to upskill in as wide a manner as possible the workforce in digital health innovation. The second was to develop a pipeline of digital innovators, of teams of people working on real digital health solutions. But crucially, these two programs are not separate. They're completely interdependent. And our philosophy is clear. If we bring together patients, healthcare professionals, researchers, and industry, we can do digital health better. And that's something that the NHS in our region desperately needs. Digital health is a very broad category. It uses digital information and technologies to improve healthcare. And although we don't have strict criteria for the types of projects we're looking for, we have a general approach which we think can apply to many unmet health needs. Because information itself is useless unless something different happens when you have it. If it doesn't lead to better health decisions, then it does not lead to better outcomes for patients and the healthcare system. And many, if not most, health decisions are made in the same way. It takes information, data on an individual person or patient, and it compares it against a group of people, a population, people who had the same condition before, people who've had the same drug before, people who had the same symptoms before, to try and understand what's wrong with this person, what should we do about this person, what tests do they need, what should I do to improve my chances of not developing disease. So a question we want to pose all our digital innovators is, what are the health decisions that need more data on the person and the population to do this comparison better and to make better decisions? We're establishing an innovative infrastructure which can support lots of projects like this. It starts by recruiting diverse participants in different studies and obtaining data that we don't have on their quality of life, on their symptoms, on their physiology, so how the body functions, what they do, their mobility and their environment. And this might be using existing commercially available technologies or technologies that we develop and build ourselves with partners like the Advanced Manufacturing Research Centre or our industrial partners. But these types of data alone are not enough. And we will combine them with the data that we already have in the NHS systems into a secure data environment accessible for research teams so that we can apply techniques like artificial intelligence to develop tools that are better at predicting disease, more accurate and faster at diagnosing disease, and that help us understand what treatment is the right treatment for an individual. So, for example, can we find ways that mean we can study someone's activity and compare it to similar people to understand how well they're doing after operations, to decide, do they need to come back to clinic, or can we allocate that resource to people who need it more? or if we understand that someone's symptoms are worsening in the community, in between the very occasional times that the workforce, the medical workforce, see those people, can we then identify people who need more tests or referral or increases in treatment so that we prevent deterioration quicker and more accurately? This is not a competition where most people get nothing and a few winners get funding. We want to work with you so that everyone who participates benefits in terms of training. We need to establish what our communities and our colleagues feel are the most pressing unmet health needs. And we'll work with you to understand what is that problem, what happens today, how many people does it affect, and what are the consequences of not improving it. So to explain how the innovation pipeline is going to work, I'm going to pass on to my colleague, Professor Chris McDermott. Thank you.
Thank you, Tim. Hello, everyone. So the innovation pipeline, it takes innovators such as yourselves who have identified a real world problem. It helps you take that real world problem, develop a solution, put you together in teams that really help understand that problem and the solution, and take it into a scalable, investable proposition. A proposition by which you can get funding anywhere. Our approach is using the tried and tested design council approach, so the double diamond. So at the start, there will be the problem, the idea. We're going to encourage people to take a step back to really understand the problem. Is the problem actually what you thought it was? Is the solution that you perhaps had in mind, is it the right solution for that problem? We're going to help bring together teams, put innovators together with our PPIE jury, give training. All this will happen in the first part of the diamond. So the offer to innovators in this first half is training that can be bespoke to what you need to develop the solution to that problem. We then move on to the second half of the diamond, where we help the teams develop the idea, begin to test the idea with our citizens' juries, with our PPIE. We offer bespoke mentorship and training through this period, so that at the end of this development phase, you have a scalable and investable proposition. In terms of funding that's available, so in the first half, it's the training and it's the value proposition is the training and the mentorship that we're providing, and that is free to all those that come and join us. In the second half of the diamond, we will be providing seed funding for projects, and that seed funding will vary depending on the scale and the potential impact of the proposition. We look at what match funding teams are pulling together. And we envisage supporting a range of projects, some smaller projects, 10, 20,000 pounds, a few others maybe at the 50,000 pound level, and some exceptional projects may be funded at around the 100K mark. But it's important to emphasize that even if we don't specifically fund a project in this phase, we will still work with teams to help them get funding from elsewhere. So the timeline for this, we're having the webinar today. We open to our sandpit applications on the 1st of February. So the sandpit is where we're going to bring together you, the innovators. We're going to match make with people from different skill sets, mix with our PPIE jury and with our trainers. We then will work with you to develop the application for funding, during which there'll be further training, further mentorship, interaction with our PPIE partners. And at the end of that process, we believe the teams will put together very compelling funding applications, and these will be judged in June. And to emphasize, there will be training throughout this process, and to hear more about what that looks like, I'm going to invite my colleague, Dr. Marjory de Costa Abreu.
Thank you, Chris, for introducing me. So everybody, I just wanted to start telling you what we mean by training. So we don't expect you to come here and do a whole degree because you need to understand about artificial intelligence or the NHS, for instance. So we want to make sure that we support you throughout the process with the bespoke training that was already mentioned, but also to make sure that we are tailoring the needs of each participant in each of the teams. So just to expand a bit more on the double diamond exercise. So we have what is happening today. So we have already a selection of pre-recorded, easy to understand material that you can access on our website, which is related with the topics that might be relevant for you who want to engage with our process. So you might want to know a bit more about artificial intelligence, or what is data, and what is health data, and what kind of data can I access in the NHS, for instance. Or you might have never done any innovative project before, so you want to understand how is the process, how can you think about look at a problem, propose a solution, and then take it to a product. So all of those types of training, they will be selected for you. So you don't need to worry about where to find what is good knowledge for you to understand what you need to understand. So that's going to be provided throughout the process. So between now and the sandpit, we will provide each of the teams, each of the people who want to engage, the specific needs that they have in terms of what they need to understand. I just also want to emphasize that we don't need you to become a specialist in every single aspect of the project. So we hope that this process brings very diverse people together. So we want to see teams with nurses, with doctors, with engineers, with IT specialists, with people from the community, with maybe someone who has experience in patient and participant integration. So we want to make sure that everybody who has a problem, who has identified a problem, and who can benefit, can contribute to propose a solution, is part of the team. So we will provide different training to each person in a single team. So you don't need to worry that you might, be working with an engineer and you might be expected to understand everything that the engineer does. That's not what we want. We want to make sure that everybody feels part of the team and understand enough so they can can develop the solution. Apart from that, as already was mentioned, we will provide a range of mentors. So initially you would be allocated a main mentor, and this person between now and the sandpit will be the person responsible to make sure that this person is going to work with you to identify specific training needs, and that's what is going to be feedback to the training that we will be provided, and we will design it. But also we will be working very closely with the PPIE team to guarantee that whatever idea that you have to solve the problem, it can be validated if needed by the community that will be partners in our team. So that's until you get to submit your proposal. Once you do that, we will be able to provide you with the same bespoke training, the same, access to mentors, but also we have an amazing selection of industrial partners, and they will also be, providing you if your project has aspects of it. They will be providing you with training on specific equipment, training in understanding specific techniques that might be useful for the solution that you want to propose, and then advice as well. So we want to make sure that all the aspects of designing this idea will be supported throughout the process. As I said, we'll be working very closely with the PPIE team, and I'm going to invite my colleague, Professor George, to talk about that. Thank you.
Thank you, Marjory, and welcome to everybody. It's lovely to see so many of you here. So as Marjory intimated, I'm involved in the PPIE, the Patient and Public Involvement and Engagement aspect of this hub. And the reason for that is very clear, that the EPSRC as funder, we're clear that what they're looking for is co-creation of solutions that involves patients and carers, as well as clinicians and those other disciplines and professionals that have been mentioned. And the reason for that is that they and we know that previous attempts at many digital health innovations have failed or failed to realize their full impact and benefit because of a lack of early and sustained, meaningful or inclusive public involvement. And so the hub really is a great opportunity actually to do things differently. To move away maybe from some of the jargonistic patient-centeredness or tick box or tokenistic or signing off approaches that we may have tried in the past, and actually really try and involve patients in the public view at the earliest and throughout stages of our projects. So what are the sorts of things that we're looking for, both from teams as they come forward, but also to support and encourage individuals as they're starting to make their teams? Well, how are patients and the public represented within the team? We're very conscious that digital health innovations particularly bring with it concerns about widening health inequalities and the potential for that. We're keen to involve and support projects that will actually do the opposite. So how are teams and how can we support teams involve relevant underserved groups and individuals in their work? Is there evidence that the problem that we're looking at has been identified with or by patients or members in the public? And related to this, the hub has already involved and engaged members of the public in a citizens' jury in Sheffield. I'll go on to mention just a little bit about their findings in the coming slides, but needless to say that we're keen to support projects, particularly those ones that address priorities and principles that were identified by the citizens' jury. And lastly, are there credible plans moving forward for how we're going to co-create the solutions here and how can we support that? Is there sufficient budget allocated towards public involvement? And is there a plain English or easy read summary that's going to be accessible to members of the public here? So I mentioned the citizens' jury. This was held back in November with 14 members of the general public drawn from across Sheffield. And we asked them to deliberate after hearing expert evidence from a number of different sectors on what might be the priority health conditions and groups that we particularly want to encourage innovation. Now, I preface this by saying that we will welcome ideas and applications from fields other than these, but these are ones that we would particularly welcome and want to support. So they highlighted mental health and people living with mental health conditions. They also were keen to see applications that related or supported people living with long-term health conditions, including high blood pressure, diabetes, dementia, and Alzheimer's. They also wanted to target digital health innovations and new ideas towards high-risk groups. For example, individuals that have, through a family history, have high risk of developing future chronic conditions. And they also felt that it was important to address health innovations towards currently underserved groups, including the terminally ill and those with disabilities. There's further link there at the bottom of the screen, incidentally, if people want to read more or hear more about how the citizens' jury ran and a bit more about their findings in full. They were also asked to deliberate on wider aims and priorities. So improving and enhancing physical and mental health and well-being through early detection emerged as a key aim or theme. So too were digital health innovations that could reduce or smooth out in some way the health inequalities that the jurors heard so much about in their deliberations. They also wanted some attention towards the education and training for people that was tailored to individuals that would allow them to engage and best use digital health innovations. And they were conscious that rather than developing lots of new gadgets, they were also concerned that we would try and improve the capabilities, the accuracy and the reliability of currently available things that they may already have access to. While Sheffield is mentioned there on those slides, I would just emphasise that the remit of this and the way that we will look at it is beyond Sheffield, clearly applies to the wider region and beyond. Lastly, they touched on principles that they wanted to see the hub's work embrace, and none of these should be a surprise given previous public deliberations, but I think worth reinforcing again. So privacy must be respected and maintained within digital health, and they were keen that there were appropriate safeguards for data security, that digital health tools should be accessible and affordable, that they should promote controlled access to data, that we should be enhancing existing NHS services and not replacing staff or working against them, that we wanted inclusive support for vulnerable groups, and that decision-making should be open to public scrutiny and governance. And so these are principles that we'll be hoping to support and apply and use throughout the work of the Hub's activities. So what next? Well, there'll be public representation at the Sandpit event in March that you've heard about here. We'll be inviting our jurors back, and voluntary and community sector organisations were part of this call, and we hope will also be represented at that event to help with matchmaking, sense checking, etc. around those initial ideas. In between the Sandpit event and the decisions to submit and apply and give for funding, we're going to provide access to PPIE panels for those teams that require it. We're conscious that some teams will be arriving at this call with existing or established partnerships, but many will not. And so we want to ensure that they are accessible. So there will be public panels available for concept testing in between the 4th of March and the June submission deadline. Beyond that, for projects that then pass through and receive further funding, we'll be helping and working alongside those projects to provide project support, specifically around public and community involvement. That's the end of the presentations for now. We're going to pass on to the Q&A. Now, I can hopefully see that we're getting some Q&A starting to come in now. I know you've been listening attentively throughout here, but if you can keep adding in those questions, we'll now move to answering them in the panel session. So please do note them down and we'll start asking away.
Thank you, George. So our first question is from Andrew, and Andrew is from Future Care. And Andrew has asked, how do we share or collaborate in sharing artificial intelligence with NHS and research institutions?
So that's a great question, and that, I guess, comes from a position where you already have an artificial intelligence tool which you have developed. So if that's a correct assumption, Andrew, then what I would start by saying is when we formed the hub, we brought together multiple research institutions and multiple NHS organisations, both in terms of acute NHS care, but also health and social care. So I guess get in contact and let us know, and then we will disseminate that to our partners and discuss what interest they have in taking that discussion further. As I say, our principle is to bring together patients, healthcare professionals, researchers, and industrial partners, and we want to act as that hub, as that nexus for those kind of connections. Now, if you have a project in that space which you think is suitable for the innovation pipeline, then I'll pass that to Chris.
Yes, so I would encourage come to the Sandpit event, see what problems people are bringing to the Sandpit event, and explain your potential solution or how your application could be part of the solution for those problems. We are a problem-focused hub, so it's the problem first, but problems need solutions. And so do come and collaborate and see if your application can be part of a solution.
Thank you. So we have two questions now on the funding available. The first one is from Ningrong from Sheffield Digital, and the question is the funding only available after the June funding application? And then the second question on that is from Venet, and the question is, any guidelines on how long the project should be, and are there any restrictions as to when the funding needs to be spent by?
So, Chris, do you want to take that?
I can answer the first one. So what was just the first one again? I'm not so good with multiple questions. So I wanted to
Sorry. Is the funding only available after the June funding application?
Yes, so the offer from the hub would be, before the funding application, would be training and support and mentorship to really develop that funding application, establish the team. So benefits are not just about funding here. There's a lot of other value that the hub can add to teams. The funding itself will follow from, so the money, the cash, will come from the funding application, as you indicate in your question. We didn't emphasize that there are going to be 3 calls. So this is the first call. So this process will happen at 2 further time points over the lifespan of the hub. In terms of when does the money have to be spent, it needs to be spent within the lifetime of the hub. I think that's fair to say. So those early wave projects, the funding may stretch longer, but in the third wave, we would anticipate having to have allocated that funding within the lifetime of the hub, which ends at the moment
In 2.5 years' time. So I think we're anticipating 6 to 12 months type timeframes, but we don't have very strict rules at this stage. We want to see what people propose, and we'll work quite hard to be as flexible as we can be.
Thank you. So a question from Claire: will you be able to send the slides out to attendees after the webinar? And I think the answer to that is yes. We'll also make a recording of this webinar available as well. This next question, I think it's a comment to George, and this is from Hora from Sheffield Hallam, who says, thank you, George. PPIE is so important to ensure the interventions are sensitive to the needs of our communities. Within maternity, we have a long-standing trial of work with underserved communities with excellent engagement, e.g. women, families from ethnic minority or migrant populations. It certainly helps to create meaningful impact. So I think my question on that is, could you expand a little bit more on what you think the impact is on projects from involving PPIE?
Oh, I think we can expect that projects that genuinely involve the public and patients early on are going to shape the problem that we see. I think we'll give that credibility. I think we'll probably ensure that it's got evidence of feasibility in the longer term as well, because ultimately a lot of these projects will rely in some way on the engagement and uptake of patients and members of the public. So I think that early involvement is critically important. I suppose the other point that your comment raises, Ora, is that there is some already fantastic infrastructure, as well as groups, individuals and organisations across South Yorkshire that are offering public engagement, involvement in research projects. And I certainly see the hub's role not to duplicate that, but actually to try and network, signpost, involve those groups in the work. Now, clearly at the early stages, some of the support that we're able to offer may be limited in the sense of being relatively generic, but I think as we get towards more and more specific project support, that will be tailored to the particular individuals with lived experience, for example, the problem that the investigators are looking at.
So while I've got you, George, we've got a question as well on PPIE. Were children or young people part of the citizens' jury?
An excellent point. They were not. I preface that with there were a couple of young people, but I don't think they would quite qualify, I suspect, in this specific terminology. So no, they weren't. And I think that one of the considerations that we had going into a plan for a second citizens jury, because we're funded to run 3 of these across the lifetime, was rather than duplicate the sort of general population citizens jury in other regions of South Yorkshire, that we should actually focus our efforts towards particular groups. And actually children and young people were flagged as one specific group, and clearly would play to a lot of the strengths existing within the region as well. So I think keep your eyes open for that one. That may well be something that we do as part of a future citizens jury, and we'll be interested to hear from people with experience in that sector, and we'll work with them on that.
Thank you. So a question for you, Marjory, and that's how can we access the training before the application stage, such as sandpit preparation and PPIE engagement?
Thank you. So yes, we will have a selection of pre-curated training available on our website. If you need anything specifically for the problem that you are trying to solve, just reinforce this is a problem-driven funding type of funding. So you must have a problem. You get in touch with us, and then we'll make sure that we curate the best available free of charge training. So just to give a bit more information on what is that. So it's very easy to find information about, artificial intelligence, for instance, on YouTube or in similar platforms. But what we do, and this is the difference from for you just going outside and trying to find the training and getting it from us, is we make sure that the information provided in the videos, in the curated videos, is accurate and is going to be relevant for what you need. So we have already a selection of what we think it's relevant for most people based on the aspects of the hub. So just to reinforce again, it's problem-based, problem-driven. It should have some elements of data. So we expect you to use data from, wearables, from the NHS, and so on, and from whatever you want to propose. And it should be looking at unmet health needs. So those are the main aspects of what we want to see coming up. So yeah, if what you need is not there yet, just contact us and we'll make sure that we provide you with the best. This is going to be free, so we'll only make stuff available that is free.
I think you mentioned also in your question there about public involvement prior to the sandpit event. So I don't think we've made specific provision for supporting public involvement via the hub before that sandpit event. And so we wouldn't want to prejudice any applications for that sandpit event on that basis. I think we see the sandpit event as an opportunity for teams potentially to come together and actually obtain that. Now, clearly, some teams may have access to public panels and contributions before that, but we're starting with our sort of involvement, if you like, at that sandpit event.
Thank you. And the next question is from Mel, and Mel says, through Sheffield Digital, I represent South Yorkshire's digital tech community. How can I help connect the expertise in these businesses with teams who could benefit from their involvement?
So thank you, Mel. That's a fantastic contribution. And I wanted to say that actually one of our key roles is to connect the huge amount of expertise of the people who are listening to this call rather than sitting on this panel. And I know some of them, and we, as George has said, we do not want to duplicate the excellent work that's already going on, but we do want to help connect it up more. So coming back to Mel's point, I think the first thing is perhaps Mel, get in contact and we'll have a chat about what that looks like. It would be great if representatives of your members would be interested in joining sandpits and other training events where we can help make those connections. As I say, coming back to the fundamental principle of bringing together patients and the public, health professionals, researchers, and companies, because for something to be used in the NHS, it must be commercialized. And so bringing those teams together early is, I think, the key to better success.
Thank you. So the next question is from Claire. And the question is, please, can you expand a little on what you mean by building teams within the programme? Is this focused around the needs of the applicants, i.e. supporting the growth of the ideas, or are the teams more arbitrary than that to foster more general learning?
Okay, good question. Do you want to take that, Chris?
So I think a bit of both. again, it's problem focused. So the teams will evolve. People might come with a ready-made team, and they might not actually need much training. It might be just a little bit of signposting, a little bit of support, and they apply for the funding and are successful. We think that all the majority of people with a problem that they want to solve and develop a solution for will benefit from some of the training that Marjory and her team and the public engagement that George has described. We think they will benefit. And so I think the teams will, if people don't already have a team, then with the sandpit application process, we will do some work to look at what people are proposing, what sort of teams are already established, and we might do a little bit of matchmaking to support people coming together. I think that will certainly happen on the day. So we will help build teams that help develop the solution to the problem that's been identified. I think that will be the core thing. We have to remember that we're not just creating teams for the sake of it. The teams are being created to develop a solution to the problem and then be able to take that into an investable, commercializable proposition. I don't know, Marjory, do you want to?
Yeah, I want to add just a little bit on what is going to happen on the sandpit. We will share what the agenda, obviously, closer to the date. But we plan, the training team plans to work very closely with the people in the room to make sure that we identify needs on the person and the matching that the teams need for the problem very early on. And this, there are different approaches for doing this, but we'll have a group of people on the day supporting every step of what you need to do to be able to identify, if you don't have a team yet, where best you could contribute and which problem would be best for you to work with. So if you have any doubts, you can contact us to ask for more advice. I'm more than happy to give you, some suggestions, but please make sure that you sign up for the sandpit, because that's the best day that you can get, the appropriate feedback and matching to what you would like to do and contribute.
Thank you. We have a question next from Christian that follows on from that answer, and that's Christian asks, I'm not 100% sure if my solution fits. Is it possible to speak to someone beforehand to clarify?
Yeah, so I think I just want to reassure everybody or repeat that this is not a solution. We are not looking for solutions. We are looking to identify unmet needs or problems that happen and we don't have a solution that's fit for purpose at the moment. So we will look at after supporting, building a solution or using something that is already there to solve a problem. But if you have a solution, you can just describe what you have in your registration for the sandpit, and we might, make you the match with someone else that has a problem that fits. But if you want to ask, more specific questions, you can get in touch, and then we will try to address your questions. But the main point is that we are not looking for solutions at the moment. We are looking for problems, health-related problems. Focus on what the citizen jury told us, but not restricted. But yeah, get in touch and then we'll try to answer your question.
Thank you. So next up, we have a question from Soler, and they've asked, is my understanding about the sandpit event correct? This can be, among other things, a networking and team building opportunity for someone like me who is rather new to the UK digital health ecosystem, but possesses other required capabilities and resources.
Yes, I think it's a simple answer. Look forward to meeting you on the 4th of March.
Can I just add something on the follow-up of that question? So we want to make sure that we have a diverse teams, and diversity is in every single aspect. So if you are from a minoritized group, we welcome. If you are a nurse, we welcome. If you are a medical doctor, if you are an IT. So we don't want to see on the sandpit just a group of engineers trying to solve a problem. We want to make sure that the community is represented. We want to make sure that people who haven't engaged with digital health, but they have a problem because they have been through a situation that they couldn't deal with because they didn't have the support in place, that they come. So we want this to be an excellent opportunity for you who haven't engaged in this kind of project yet to come, talk to us, talk to other people, network, and be part of the hub. So please, come and join us.
Thank you. I think this might be a question for you, Tim. Will the hub facilitate access to patients, clinical data, e.g. from the NHS?
The short answer is yes. Clearly, there's a governance process for projects like that. And one of the key benefits of the hub is assistance in ethics and governance negotiations, which of course are very important and have to be complied with. The exact types of data and the exact processes will be dependent on the project. So that's something that we would work through in this design phase, but yes.
Thank you. So a question around the funding. How many projects will be funded and what is the overall budget available?
So the overall budget is 1.25 million. That's going to be used over 3 calls. We expect to fund quite a few projects at the 10 to 20,000 mark. We expect to fund less at a 50,000 mark, and we may fund 1 or 2 exceptional projects at the right stage at around 100,000. We're going to be flexible, but we want to take ideas at different stages, and so some will be more mature than others. We will be encouraging match funding, and when we're looking at the project ideas and solutions that come in, we'll be looking at the whole proposition, who the team are, who the industrial partners are, what in-kind contributions or match funding is there. So there isn't a specific, this is what each project is going to get. It's going to be based on the need and what the value the hub can deliver with that investment in the team.
Thank you. So the next question is from Jess, and Jess asks, digital health technologies for children and young people are often repurposed from adult tech and often don't fully meet their needs. How will the innovation pipeline support the development and co-design production of health innovations for young people?
So, yeah, absolutely fantastic question, Jess. Just to flag that Sheffield Children's Hospital and the NASS Children and Young Persons MedTech Collaborative are partners in the hub, and that we would be working with them in this space. One of the things that we offer is a customizable platform for data capture that can be tailored to the needs of the particular population, for example, children. So again, we would work with our partners with expertise in this area, some of whom are on the call, but absolutely, we're not seeking to repurpose inappropriate technologies. It has to be driven by the unmet need, as has been said very clearly by colleagues, but it also has to be fit for purpose for the intended users. And you only, I think, get that by working with those intended users, which is why PPIE is front and center of everything that we do.
Thank you. So next question is from Ali, and Ali asks, do you anticipate app development, e.g. smartphone app development linked with actigraphy, I hope I pronounced that right, to be encompassed in the training aspects of the Digital Health Hub or within funding applications in terms of solutions to problems?
Yes, both of those. And Ali, that's a really important point that we want to stress, that the projects inform the training and the training informs the project. And so, and I guess would not be a surprise if quite a lot of these projects require development of apps and other devices. And so it also requires training in how to do that. And we have partners who have, world leaders in this area.
Thank you. So next question is from Helen, and Helen asks, are there any restrictions on the location of Innovators? Is this weighted towards Innovators in Sheffield, South Yorkshire, or can solutions come from broader geographies?
It's definitely not restricted to Sheffield. We are the South Yorkshire Digital Health Hub, and we have a responsibility to address the needs of our region and beyond. It's not that South Yorkshire suffers health problems that are specific to the area. We just have rather more of them than some other areas. And but we're not particularly restrictive in terms of who we will work with or who can work with us. So get in touch.
I think emphasizing the partners on the hub are global. So we have Sheffield, South Yorkshire business partners, but also very large global partners. So I think that shows that we want a global reach, but we do want to have impact for Sheffield and South Yorkshire individuals and their needs.
Thank you. So this next question is from Lou, and I think it touches on some of the answers that had been given previously. But Lou asks, are there any restrictions on who can apply and what counts as innovation? We are a startup and have an existing digital health product on the market, but would like to develop additional functions in order to meet additional unmet health needs.
So let me take that. So Lou, that's a great question. The funding that we have is from EPSRC, Engineering and Physical Sciences Research Council, and they actually have a particular remit for low technology readiness level research. And so projects or products that are ready to go or perhaps be adapted may be outside of that remit, but we are very keen to work with all partners to secure other sources of income. And Innovate UK, for example, would be an obvious potential source of funding for that kind of project, if I've understood the description. So the pump priming funding, we have to make decisions about remit, technology level, and appropriateness, but that doesn't mean we can't help teams find other sources of funding. So if in doubt, apply. If in doubt, get in contact. We are seeking to help the whole ecosystem. And of course, these early technology readiness level projects, as they progress, as they become successful, they're going to need kind of follow-on funding from NIH, MRC, venture capital in order to get to the next stages and into procurement in the NHS.
Thank you. So I will absolutely leave this answer to the panel. So the next question is from Martin. And Martin asks, the 400 hours of ethnography within the NASS framework suggests that most digital innovations fail due to failure to resolve complexity. And Martin asks, have you system theorists within your experts?
So, well, thank you, Martin. That's a great question. So one of the key things we put in our application was application of the NASS framework to the potential digital solutions being developed. Because I think for colleagues that don't know on the call, the NASS framework is a way of conceptualizing the barriers to non-adoption, scale-up, sustainability, and implementation. And it breaks down into 7 different domains about the nature of the disease, the socio-cultural aspects, the business proposition, both to the users and to the procuring organizations, the regulatory landscape. So using this framework, and it's one of the things that we'll provide training in, allows teams who aren't sociologists and experts in this area to begin to understand where the potential barriers might be to for further development. And so the NASS framework will be a core tool that people will be trained to apply to their particular area. And this is why, even if that project doesn't progress to seed funding, the people who've been trained will be in a position to be more successful in taking that project forward and any future projects.
Thank you. So this next question is for you, George, and it comes from Andrew. And Andrew asks, I've had 2 PPI sessions. Is there a standard format or reposting? I'll start that one again. Is there a standard format or reporting post a PPI outcome review from PPI sessions?
The short answer to that is not yet, but I think we can certainly arrange for that. So if we're talking about the input and engagement of the PPIE panels that we might be convening between the sandpit event, absolutely. I mean, clearly one wants to capture all of the inputs and contributions that they have made. We haven't got yet a standard way, but I'm sure that we can develop such a thing if it were useful.
Thank you. Next question from Andrew. Are there restrictions on what funding can and can't be spent on?
Shall I take that one? And so, yes, there are terms and conditions of our award. And so depending on the specifics of what's being requested, we'll need to discuss a couple of things. The first is contracting, the second is intellectual property, and the third is whether or not funding can be spent by us on behalf of the team, which is a lot more agile and quicker, or whether it requires subcontracting and then allocation of funding. So it will depend quite a lot on the specifics of the project. There's some public subsidy rules which apply to government funding such as this. So it's not without its details, and we'll discuss it, I think, more on a case-by-case basis, because it's impossible to discuss really in a general sense.
But the other half of the offer, the mentoring and the training, we hope to be able to offer that to whoever wants to partake of it.
Thank you.
Thank you. So we're coming to the end of the Q&A session now. So time for one last question, and this comes from Joe. And the question is, has the sandpit event invite been circulated yet?
I think we're advertising the date, the save the date today, and the application form will be available on the 1st of February. So watch our website, watch our social media channels.
Thank you. And just to add, any questions that we've not got round to answering now, we'll answer either on the website or we can answer directly.
Absolutely. Please do get in contact. So just to conclude, we're very grateful to you for turning up, for asking so many fantastic questions. We'll end by just with a slide which reminds you of the time frame. We are very keen for feedback. So let us know what you think. Let us know of questions that haven't been addressed, and please stay in contact, as Chris says, via our website, our social media, and via email. Thank you so much, and we look forward to seeing you at the next stages of the project.